South by Southwest. I've been doing these introductions all week, and this is my very last one, so I'm excited to introduce this panel. I guess first I should tell you all who I am, which is that I'm an associate editor at Stranger's Guide, which is an award-winning magazine that commissions stories from local writers and photographers to build authentic portraits of places like Tehran, Lagos, and Colombia. You can learn more about what we do at strangersguide.com, but on to what I'm actually here for today, which is to introduce our distinguished panel. Dr. Ellie Babari is the chair of the Division of Infectious Diseases at Mayo Clinic. Dr. Babari has published over 160 peer-reviewed publications and has been a leading voice in the medical response to COVID-19. He leads multiple COVID-19 task forces and has been highly awarded by the Department of Medicine at Mayo Clinic for excellence in clinical teaching. Grant Morgan is the CEO and co-founder of R0, the first biosafety technology company dedicated to creating safer, healthier, shared indoor spaces. Early in his career, he led the development of multiple breakthrough medical devices at Abbott. Joanna Frank is the founding president and CEO of the Center for Active Design, operator of the Fitwel Healthy Building Standard. At the center, she advances design and development practices to foster healthy and engaged communities. Prior to launching CFAD in 2013, Ms. Frank worked for the City of New York during the Bloomberg administration, where her positions included Director of Active Design and Director of the NYC Fresh program. Dr. Joseph G. Allen is an associate professor at the Harvard T.H. Chan School of Public Health and co-author of Healthy Buildings: How Indoor Spaces Drive Performance and Productivity. At Harvard, Dr. Allen directs the Healthy Buildings program, where he led the creation of the 9 foundations of a healthy building. During today's panel, you're welcome to submit questions on the South by Southwest Go app. You can do so by clicking the Engage button next to today's panel. And now please join me in welcoming our panelists to the stage.
How are we doing? Good. Hope everyone's had a great week. I'm Grant Morgan. I am the CEO and one of the co-founders of R0, and I am today's moderator, and I have the distinct pleasure of sharing the stage with some thought leaders, luminaries, and world-leading experts on the topic that we're about to discuss today, which I believe is, in my opinion, the most pressing and important and challenging public health challenge of our generation. And that is, how do we as humans keep ourselves safe in what really amounts to our natural habitat, indoor spaces? And we're now 2 years into the COVID-19 pandemic, and we're finally starting to wrap our arms around it. We've got several vaccines that are highly effective. We've got some of the COVID restrictions are starting to relax a little bit. We're seeing herd immunity in a lot of different places, and we're starting to go back to the places we haven't been able to go for the last 2 years, like school, work, and events like South by Southwest. So I can't tell you guys how good it is to share this stage in person with all of you and share this room with all of you. But so COVID changed everything, and I think we can all agree that the world will never be the same after this pandemic. And we are still sort of understanding all of the ways in which the world has changed or will change, and still understanding the nature and the extent of those changes. But one thing I think we do know, and one thing that COVID did, was it created this sort of societal awareness of the relationship between indoor spaces and human health. And we intuitively know that all of the places that we haven't been able to go, from restaurants to hotels to school, work, whatever it may be, carry inherent risk. And we also know that there are things we can do to reduce that risk: social distancing, masks, vaccines, and things like that. But most importantly, I think COVID has shown us how inadequately prepared we were, and how terrible, frankly, we are at keeping ourselves safe in indoor spaces where we as humans really spend 90+% of our lives. And the reality that has been highlighted is that this is a problem that has existed long before COVID. And if you look at the data, the evidence is clear. 40 million Americans get the flu every year, and somehow we've just accepted that that's normal. MRSA, or staph infections, kill more people every year than Parkinson's, emphysema, AIDS, and murder combined. We at R0 have actually studied the health of indoor spaces very recently, and in fact, we took surface and air samples from various different public places, from hotels to restaurants, bars, and the like, and these are spaces where we've all been in the past week or two, and we actually found 31% of the air sampling that we did came back positive for a human pathogen. There were 4 unique human pathogens that we found, 4 emerging pathogens that we found. We found 6,000% higher skin cell concentration in the indoor air compared to the outdoor air. We found 530% higher concentration of fungal spores indoors versus outdoors. And then, one of the panelists on the stage with me actually taught me this, but 4% of the volume of every breath that you're taking, 18 to 20,000 times a day, was in somebody else's lungs in this room. So I think that the impact of COVID is that we have this awareness, and we have started the conversation around healthy buildings and how we keep ourselves safe in indoor spaces. But we have to do better coming out of COVID. We've lost 6 million lives and counting, and shame on us if we let them die in vain. And we're here today to talk about what that looks like. How do we create a healthier, safer, better new normal? And I couldn't be more proud to share the stage with some of the world-leading experts on this topic, people who have been talking about this for a really long time, and who have really been luminaries and thought leaders in leading us into this new healthy buildings era, healthy buildings movement. And so before we jump into the discussion, which I know you don't want to hear from me, I'm sure you want to hear from them, I'd love for each of you to kind of just introduce yourself real quick, and then we'll get to it. But we'll start with you, Joanna.
Sure. So hello, everyone. Joanna Frank. I'm the president and CEO of the Center for Active Design. And we run the Fitwell, which is a healthy building certification. And our partners, our research and evaluation partners on that, are actually the Centers for Disease Control and Prevention, the CDC, who need no introduction at this point. So great to talk about this subject. Really excited to kind of share some of our insights. Thank you.
Joe?
Great to be here. Joe Allen, professor at the Harvard School of Public Health, director of Healthy Buildings Program, CEO of a company called 9 Foundations. My team is right over there. And I'm the one who told you about that, and I'm going to make it more real, even more real. So this idea that we're all breathing each other's air, just real quick. It'd be like I take this sip of my water, pass it around to everybody, and we share this glass. It's the respiratory equivalent of backwash, what we're doing. I'll make it worse for you. Look to your left and right. It's the equivalent of locking lips with the person next to you 1 out of every 20 breaths. That's what we're doing. That's why these viruses spread indoors so easily. We're constantly sharing our air, and if we do it poorly, it's a recipe for disaster. So on that note, good to be here.
Thank you. So, Dr.
Should
Barbari?
we leave?
Yeah, we're good right now, actually.
Oh, kiss.
All right.
I saw a few people
So
shift.
I'm Ali Barbari. I am an infectious disease physician. I spent most of my career studying risk of infections in a hospital setting or a healthcare setting. I was very interested in surgical patients. When COVID hit, I really started shifting my research and my career into the COVID space, spending the last few years responding to COVID, studying COVID, and better understanding the environment that causes COVID. So.
Awesome. Well, thank you. Let's dive in. So the first topic I want to discuss is sort of how the world has changed, what changes we see, and what we think will stick. But historically, if you look at tragic events in the past, from the 1918 Spanish flu, which gave us modern hand hygiene, all the way through 9/11, which is non-sort of epidemiological event, we got the Department of Homeland Security and the whole Homeland Security apparatus. But point being, coming out of these tragic events, there are lasting societal and infrastructural changes that take place and really take hold. And so, we at R0 have really hypothesized that there would be similar changes coming out of COVID, but they would revolve around indoor health and safety and human health. And Joe, you've been shouting this from the rooftops, from your book Healthy Buildings. and really helped a lot of us get up to speed. But I want to start with you and just ask, what changes have you seen that you think will stick? And also, what changes do you think should stick?
Yeah, it's a really good question. I think the one that'll stick definitely is that awareness has changed. Everyone's now an expert, or should be anyway, in things like MERV filters, air quality, ventilation, things that we've been talking about for a long time. But it took, honestly, a year for CDC, World Health Organization, and others to even recognize that this is how respiratory viruses are spread, through the air. It seems so obvious, but actually that's not what we thought. At the beginning of the pandemic, 6-foot distancing, a lot of hygiene theater, you're wiping down your ketchup bottles, your mail, like silly stuff, totally detached from the science. So there is a paradigm shift happening right now in that we're changing our understanding of how these diseases are spread, and if you ignore it at your peril. Because the medical textbooks are literally being rewritten about our understanding of things like even influenza. So what should change, what stays? I tell you, the reason we have a problem is because the design standards for buildings are designed for bare minimums right now. In fact, the standard that sets ventilation in this building and everywhere you go is called the standard for acceptable indoor air quality. Acceptable, bare minimum standards. So now you have a novel respiratory virus, spreads entirely indoors, and every shop, school, airplane you walk into is underventilated because we've designed not for health. Starting in the 70s, we entered the sick building era as we started to conserve energy, it's an important goal, at the expense of human health. This is why we have such a massive problem right now. So this is the shift, and we have to switch designing buildings for health, as silly and as obvious as that sounds. We should have been doing this from the beginning, but we really lost our way over the past 100 years.
Thank you, Joe. And Joanna, same question to you. What changes have you seen that you think will stick and should stick as well?
Sure. So, I mean, the folks that we work with really are the owners of real estate across the world, the investors in real estate, those who design it and maintain it. And what we've really seen over the last 2 years is demand has changed. And that is going to change everything. So individuals are demanding that the places that they live and the places that they work and the communities as well are designed to be optimized for their health and their family's health. And that's a huge difference. I mean, we've been doing this for 10 years. And when we started in New York City, we were told that we were a nanny state and don't tell me how to behave and all of these kind of things. And we're like, we're just asking you to take the stairs, guys. I mean, it's not a big deal. But really, I think that's fundamental. When people start demanding it, then obviously the industry has to respond, because in order to attract tenants, in order to maintain tenants, you have to be able to demonstrate now, right at the beginning, like, how am I protecting your health? How am I optimizing this environment for health? And likewise, on the investor front also, demand from investors globally is really now looking at health. So health has gone from a nice to have before COVID. Folks were thinking about health as far as, oh, I've done everything else. I've addressed my sustainability. I've addressed my energy use. And now I'm going to think about health. And I'm going to think about it as a way to positively differentiate my property from others. But all of that has changed. Health has now moved into the category where it's a risk if you cannot describe how you have optimized your building in order to protect the health of the occupants and now start to optimize it. So we need to go way beyond just protecting health, right? We need to be using our buildings to optimize health, and there's plenty of ways that we can talk about that you do that. So with demand changing, you are going to see changes in the built environment, because if you want to be able to lease your building, if you want to be able to sell your building, if you want investors to invest in your companies, you are going to have to demonstrate that you are not just addressing health, but you are addressing it at a standard that is rigorous, that is evidence-based, and that you are meeting those standards. So yes, not the building code. Fitwell is a standard that is optimized for human health. So there are standards. This knowledge exists, right? This is not new science, but the demand is new.
I love it. So Dr. Barbari, from a physician standpoint, how has the world changed? What changes have you seen, maybe even particularly in the healthcare environment, and what do you think can and should stick?
Yeah, from my standpoint, the world has changed and healthcare has changed. We were not prepared for this, especially at the beginning of the pandemic. We were disjointed in our response. Our system didn't connect. As we move forward, healthcare was more like a pipeline. Patients came in, they were sick, we treated them, and we dismissed them. Right now, we have to move into more of a platform model where we partner with companies like R0s and so we can gain assets and capabilities. We are very good at discovering vaccines, and we are very good at discovering drugs. We are not very good at environmental stuff in the healthcare setting. And I think these are the gaps that we're starting to identify, so we can really enhance and improve, the environment, the air among our most vulnerable in the hospital and the clinic. Healthcare is changing. I mean, COVID is a catalyst. There's changes in every aspect of the care, from virtual care to more connected care to really, just think about it. In 2 years, we were able to identify effective vaccines, effective therapeutic, effective diagnostics. These things took 17 to 20 years before COVID. Just that fact, how quickly we can accelerate the development and the implementation of change, that is going to stick in healthcare. So it's accelerating, it's changing, and we're way ahead of where we thought we're going to be.
I love that, and it's a perfect segue into the next topic I want to get into, innovation. And I'll start with an anecdote that I'm sure a lot of you can relate to, but at the beginning of the pandemic, I noticed everyone's sort of wiping their groceries down with Clorox wipes. And you might have had a box in the corner of your garage to take your sort of hazmat suit off after you came back from the grocery store. But I had this sort of light bulb moment where realized that, look, we are still using the same archaic chemicals in 2020 to fight COVID that we used to fight the 1918 Spanish flu pandemic. And in the 100 years since the Spanish flu pandemic, we've sent people to outer space. We can now land rockets back on autonomous drone boats in the middle of the ocean, but we're still using the same chemicals to fight COVID. So I want to talk a little bit about what are some of the examples of the innovation that you've seen, like some of the vaccine developments that Dr. Barbari mentioned or otherwise. But what are some of the innovations that you've seen accelerated by COVID that stand to benefit society long term? So I'll start with you, Joe. You look like you.
Well, yeah, a couple ideas. I agree. I think a lot of the innovation we've had has been government-led or public-private partnerships that have spurred development, like the vaccines, therapeutic, now rapid tests, even masking finally came there. But the pillar that's missing that the White House is finally talking about and others are these healthy building strategies. So where there's room for innovation, talk about a field ready to be disrupted. It's a multi-trillion-dollar industry. It moves so slow. But yet, now everyone's paying attention. The market is really hungry for solutions like your company's developing and others. And I think one of the key innovations that has to come is to move beyond design-based standards and get to real-time verification of performance, like the proliferation of low-cost sensors that are changing, or our ability to understand how this room is changing. By virtue of us being in here, we have changed the room. Buildings are not static. They change, of course, over years, but they also change on the course of a day. In fact, it's changing in over minutes in here. And we now have the technology and the platforms to start integrating all of this data so that we can autonomously control through the building automation systems when we need to make changes for what's happening outside, air pollution day, wildfire, smoke. The building can respond without us having to look at a sensor, make a tweak to the building, go to the facilities team. It's automated. All the data is getting integrated, and we can actually have healthy buildings that are verified in the moment. The design standards right now, you may not know this, but like a school designed in the 1970s in the US was designed in the 70s and has never been looked at again for 40 years because it's not a performance-based standard. But we have the tech and the tools to do it, just no one is really doing it yet.
Speaking of, what are our CO2 levels in here?
Yeah, we're doing pretty good. So we're at 870 parts per million. It's a CO2 monitor. You want to be under 1,000 would hit that bare minimum. If you're in 800, pretty good. Just quick, CO2 only tells us about ventilation, but if you're thinking about things like respiratory aerosols and the virus, you have to account for filtration also. CO2 is only telling us the benefit from filtration. High CO2 doesn't necessarily mean it's bad, because you could have excellent filtration, but low CO2 means you're in good shape. So we're in good shape. I've been tracking this everywhere we go.
Awesome. That's why I love Joe. He doesn't make fun of me for carrying my CO2 sensor around. But, and then Joanna, same question. What innovation have you seen accelerated by COVID that maybe was once needed that will benefit us long-term societally?
Sure. I think there's a lot of innovations that are going to come because of the kind of shift in focus. And I want to broaden the conversation because obviously infectious disease has been top of mind for the last 2 years. We're talking about indoor air quality. But I think it's really important for us all to talk about the fact that our built environments, the design of this room, for example, with no natural light, actually impacts all aspects of your health. So it affects your mental health, it affects your physical health, it also affects our societal health, so the trust we have in one another. And that's the design of your streets, your neighborhoods, how well maintained they are, how much greenery you're exposed to, either inside or outside of the buildings that we live and work in. So I think it's really important to kind of keep this conversation broad, that this isn't just about mitigating infectious respiratory disease. Absolutely, buildings can be used to do that. But buildings are impacting all of the aspects of your health, whether you know it or not. And so I think it's important to understand that we have the research. There's 100 years of public health research. There are thousands of studies that actually show us how do we create an environment that is optimized for people. And we know the answers. So there's really no reason for us to be kind of like, oh, if only I knew how to do this. We know how to do this. So that's why the demand piece is so important. It's also important to be talking about these things. I think one of the big things that actually has happened with COVID is, yes, it's been a pandemic of an infectious respiratory disease. It has also been a pandemic or an epidemic of mental health crisis. So mental health, depressive symptoms were already the #1 cause of disability before COVID globally. So the #1 reason people were not going into work was because of mental health, because of depressive symptoms. That has only escalated because of social isolation and because of all of the anxiety, which just seems to keep going, more and more anxieties. And actually your indoor air quality impacts your mental health also. So I think it's really important that we don't just demand that our buildings protect our health, but that we actually are looking at buildings that create environments where we thrive. So that to me is a discussion that we were not having at scale before COVID. There were some who were talking about it, but now it's a conversation that I think everybody's having. People are demanding that we really look at individual people. One of the investors, we work with a lot of investors, we surveyed, did a big survey of global investors last year, and one of the big shifts that has happened with institutional investors, especially in real estate, previously, they said that they were looking at investing in properties or portfolios of property, and they were not considering the individuals within the buildings. Now they understand and have made this connection between how when I invest in a building, I need to be thinking about the individuals who are going into that building every day, who are living in that building, because if they don't choose to go to that building, that has massive financial consequences. And that is a massive shift. When you start thinking about people rather than buildings, then you really start to kind of shift your thinking, like how do I create a building that's optimized for people? Otherwise, why have a building? We don't need a building if we don't have people.
Yeah, a really important point about sort of extending the conversation to holistic human health and understanding that it's more than just about respiratory diseases. It's about overall well-being and performance and optimization of humans. And I love that we're taking the conversation there as well. Dr. Barbari, why do you think it took a global pandemic for us to start having this conversation? And what do you think we can do to keep the conversation going, keep the momentum, and turn that into action that benefits human health?
Well, I mean, I don't know why it took a global pandemic. With any major crisis, there's disruption. And you could see the history is filled with that, from the Second World War to the First World War to the polio to the AIDS pandemic. Society changed from external shocks, and this was a shock of a lifetime, especially for an infectious disease specialist who found themselves in the middle of this cyclone. I'm just going to ask, if it's okay, do you know someone that have passed from COVID? If you have, just raise your hand. I mean, that's remarkable.
Shocking.
That's shocking. We've all been personally impacted by this. And that's why it's personal, right? That's why we're willing to change. And I was hearing the discussion, things that are changing, like artificial intelligence and data. This is really, really powerful. Early in the pandemic, I was put in charge of testing at the Mayo Clinic. This is a huge facility with tens of thousands of patients, 70,000 employees. We had scarce resources in March of 2020 on how we test. So we wanted to ration testing, but we also wanted to test. So we were learning and testing at the same time. And that's unique. Before we would learn, we would do the studies, and then take time to apply them into healthcare. In this setting, we were learning and applying at the same time. It was really in tandem and correcting the learning. So that's kind of, and then the other thing is a prediction. Prediction of what's going to happen in the next few weeks. This is, I think, huge in terms of forecasting for a healthcare setting. If we knew or had a little bit better estimate of what's going to happen in the future, it's like, forecasting the stock market. You could do really well. The ability to forecast the risk in an environment. You have a gadget that's collecting some data. What if we have a lot of gadgets and we combine that through some sort of algorithm or artificial intelligence? Then our ability to forecast is increased. And I think that's what we're seeing in terms of transition and change. But the reason why this is so powerful, because it's personal. If I were to ask you, did you know somebody who had COVID, or have you personally contracted COVID? Please raise your hand. Almost everybody. And that's why it is. It's personal.
Yeah, it's an excellent point. And unfortunately, I had to come to this to kind of really help that sink in. But I think our job collectively is to make sure that we don't put ourselves in this situation, that we're better prepared, that we're better optimized in the future. But Joe, Joanna, like both of you have been shouting this message from the rooftops. I'm sure that there's you probably feel a certain way about sort of this conversation coming into the spotlight. But what have you seen be the catalyst, other than that it's personal? Why do you think it took a global pandemic, and what do you think is different this time that we can use to carry that momentum and keep the conversation going and turn this into action?
Yeah, I mean, I think what we see from a business perspective is that kind of shift from health being a nice to have to a risk, that is a fundamental shift in the way that you're actually kind of considering health as a priority. So as an investor, you're now looking at that in the kind of potential negative column. And that is taken very seriously. So I think really understanding that the health of the occupants of buildings is a risk. It's a risk to the overall occupancy of your building. It's a risk to your tenants. Tenants obviously want to be able to attract and retain talent themselves. They need to be able to tell their employees that our building is health promoting, and we can demonstrate it because we have the data, we have the testing. Turnover of staff is a huge cost to business. It's something that was already driving the healthy building movement before COVID, actually. So that's only accelerated because of COVID. So I think that all of these things, this understanding that health is a risk from an investment perspective, and then the other big thing that has shifted from a business perspective over COVID is this kind of new phenomenon called ESG, or environmental, social, and governance investing. So global investors are using these metrics really to describe the risk of the investment they're making around environmental concerns, social concerns, and then the way that companies are run. And COVID was a stress test. It was an opportunity to look at, are these metrics that we think are going to mitigate our risk, are they actually working? And companies that had scored highly on ESG metrics, that were doing all these things around environmental and social preparedness, were actually outperforming the market by about 80% of conventional assets. So that has just skyrocketed the amount of money in the market that is looking for investments that have ESG metrics. Is going to be $50 trillion of money by 2025. That's a third of the world's economy. Will require you to be able to demonstrate how you are meeting environmental, social, and governance goals. And it is our job, all of us on the panel here, to ensure that health is in that conversation, because health is not as easy to measure as carbon. I think we would all say it is easy to measure, but the perception is that it's hard to measure. So this is a big shift. This is like a once-in-a-lifetime shift as far as investment is concerned. And it's going to affect real estate. It'll affect all companies. That amount of money, it will affect everybody.
Yeah, and Joe, I'd love to give you a chance to answer as well. But I think one of the things that Joanna touched on that was illuminating when I listened to the outcomes of some of your research was, it's not just about risk mitigation, but it's about optimization. There's an upside to this. You can actually optimize the performance of your workforce, the occupants of your space. But what do you think has changed? Like, how do we make sure that your message, other than everybody here go buy a Healthy Buildings book and read it, it's fantastic. But how do we make sure that we carry the conversation forward? And who needs to be brought into that conversation to make sure that we have lasting change?
Yeah, it's a really good question. I mean, we've been doing this for 20 years, and we knew this moment was coming. It was obvious. We're an indoor species that our building health is human health, all aspects. Cognitive function, what my team likes to study at Harvard. We've done a lot of research in this space. It's heart health, it's hormone health. And it did take the pandemic to shift everyone's mindset, but I tell you, there were companies who were on this before, because the value proposition for them was around worker productivity. And we've done a series of research we call the CogFX studies, look at the cognitive function performance of people in places with better air quality. And we see just minor tweaks to a building leads to better performance, higher order cognitive function on crisis response, strategic thinking, information seeking. So a lot of CEOs saw this before the pandemic and started to act on it already, and how they design and operate their buildings, because it's a no-brainer. The value proposition on energy is easy, back of the envelope. How do you calculate human health? Well, if I say, I'm going to put you in the office, give you better air quality, you're going to be 4 times as productive. That's a 10% hit to our bottom line, which is the focus of my book. I wrote it with John McComber, the Harvard Business School professor who focused on real estate finance. This is real math. Right? Improve the air, you're going to perform better, bottom line performance of my business. A lot of people jumped on that. COVID hit, now it's a no-brainer, right? We're going to get the productivity benefits, but it's existential for companies. Can you bring people back? What we're seeing now with this shift, and this is your point of like what's going to stay, is that as people get a handle on COVID, they're realizing that it's the same exact strategies for COVID, and whatever comes next, it's a hedge on risk, but also this chance to capture the productivity benefits, attract that talent. You spend all that money to attract talent, you want them to perform their best. Who's going to come back to the office in the first place unless it's healthy? Who's going to go back to an unhealthy space at this point? No one. So the stakeholders have changed. So before the pandemic, probably we're dealing with facilities managers. Now and going forward, it's the CEO
Yes.
paying attention to their real estate. This has never happened. This has never happened. All of our conversations are with the CEO. So why? That's one stakeholder group. It's the investment stakeholder group, but the biggest stakeholder group is all of us. We write about in the book, employees are interviewing their building. People are experts in this now. They come in and they're asking these questions. I've seen it. CEOs say, well, we have to have an answer for this. People want to know, what's the air quality like? Are we measuring it? Or if you're not, they're going to come in with this and tell you you're doing it wrong, and they'll shame you on Twitter and wherever else. This is happening. So the stakeholder group has just expanded, right? So, and the value proposition has expanded too.
Yeah. I love that. I think that's a super important point, and to kind of hit it home too, if you think about a company's overall spend, a small percentage of it is keeping the lights on. It's the operating cost, call it 7 to 10% of a company's overall spend, whereas 60, 70, 80+% of a company's overall spend is their headcount, it's their people. And so that's a much bigger lever. And if you can get 1 to 2%, extra productivity out of your workforce, that's a much bigger lever, much bigger ROI compared to saving maybe 30% on your energy bill every.
Let me put a number on it from our study, and it's in the book, right? So the cost to optimize ventilation to get these productivity benefits is on the order of $40 per person per year. That's like nothing for a company. The cognitive function benefits we estimate are on the order of $6,000 to $7,000 per person per year. When you put human health in the cost-benefit equation, it just wipes out these cost considerations. So we keep getting these questions. Is it expensive to have a healthy building? The answer is no. It's expensive to have an unhealthy building.
Yeah.
Like this is no-brainer math, and the market's starting to pick up on it.
Yeah.
Yeah, for the cost of 40 Topo Chicos, you can keep people healthier.
Yeah. I think also, just to kind of expand on that, we're seeing that there's a positive correlation the more you do to promote health. So we just looked at kind of the full Fitwell standard. So that's looking at walkability, it's looking at indoor air, yes, of course, but it's looking at cleaning protocols and integrated pest management. I always like that one because it's so not kind of glamorous, but so important. But what we're seeing is the more you do, it has a direct correlation to greater tenant satisfaction, greater kind of recommendations. So it isn't just that there's a baseline and if you do it, everyone will be happy. The more you do, the happier, the more content, the more satisfied your tenants or your employees will be. And so I think that this data is new because we haven't had enough data, we haven't had enough standards, we haven't had people willing to give us their data sets to overlay with healthy building data sets. But now, because of the business imperative, because people want to be able to demonstrate that they are actually responding to this new demand, we are able to now kind of really actually demonstrate this using the data. And these are not anecdotes, right? These are large data sets. They have statistical significance. So this will all be rolled out, and all of the kind of competitors of these companies will be like, oh my gosh, I need to be doing that, right? If I'm not doing it, I'm going to lose my workforce to these people. So I do think there's enough momentum now. There's enough information. The evidence base was already there before COVID.
I love that. I want to switch gears a little bit and talk about why this is a public health issue. We talked a lot about businesses. There's a lot more to our society, but and I also want to dive into some of the questions that are being asked out here. But I want to start with you, Dr. Babari. You're one of the world's leading experts in infectious disease, and hospitals are often considered perhaps the highest risk environment. The fact that you can go into a hospital, receive care, and come out by and large without getting infected by anything else that's within those four walls is pretty remarkable. So can you talk to us a little bit about what's working, what's not working in terms of infection prevention today, and any ideas you have about inside a hospital or outside a hospital as well?
Yeah, I mean, you're right, Grant. I mean, at the height of the Omicron surge, our positivity rate was almost 40% in some of our sites. So just imagine, 4 out of 10 who are being tested were positive for Omicron. Now it's down to 2, 3%, 1%. So this is really good news. This was a priority for us. We knew that we had a higher density of patients with COVID. Early in the pandemic, some of our colleagues, physicians, came down with COVID, and some unfortunately passed. So this was really, really a priority for us. At the Mayo Clinic, in March of 2020, we had to shut down the practice because we didn't have tools to prevent the transmission of COVID in a healthcare setting. Mayo Clinic made a hard decision to stop its operation except for emergencies. And I was part of that decision. It was the hardest decision. It's like I'm a chair of an infectious disease division. I'm not the CEO of the Mayo Clinic, but it was a very hard decision. So this is really the magnitude of this, because we didn't have tools. Now we do, but there are still layers of holes and gaps. And one of them, the major one, is the environment. We paid attention to testing, to vaccine, to masking in the hospital setting. We have an ability to track a transmission within an environment, but we don't have a real way of monitoring the air in a real-time fashion and then integrating that information in a way that's useful and tools to prevent that. And I think what your company is doing is really trying to change that and some of the work that's being done. But we're really at the onset of this. The standard has not been met, has not been designed. Nobody knows what the standard is. So it's going to take a lot of competition. It's going to take a lot of acceleration, but we're seeing it. It's starting, and I think over the next few months and few years, if we can keep it and keep our foot on the pedal, we're going to see change, and hopefully we can get to a point where we say, this is a standard. We know that this impacts COVID, and now we can enter a room like this and say, there's no risk. Right now, nobody knows that.
Fantastic answer, and I want to pick up on. I'm going to weave some of the audience questions into this next question, but I'll start with you, Joe. Can you explain to us what a healthy building looks like? What are the important aspects of a healthy building, and then maybe touch on a few examples that you've seen, and paint that picture for us.
Yeah, sure. So a couple of years ago, my team I was at the real estate roundtable, so big group is Influenza in Washington, real estate community. And I said some offhand comment like, well, we all know what it takes to make a building healthy. It's not hard. And everyone kind of leaned in like, well, what is it? And that's when it occurred to me that our field, all the science we're producing was like siloed in these dusty academic journals and hadn't reached the market to the decision makers. So I brought it back to my team at Harvard, and we created a report we called the 9 Foundations of a Healthy Building, which starts to establish, taking all these decades of scientific evidence, and say, well, what really matters for health? Some of the basics, air, lighting, water quality, right? And putting the scientific evidence behind it in simple language. What is it? Why does it matter for health? What is the scientific basis for how it influences all of our body systems? And then what do you do about it, right? So it's not just complaining, it's solutions-based. And I think that started to change the market and the way we talked about our research, and it gave a platform for us to talk about all of this research, which people would be bored to death to talk about these peer-reviewed papers and the titles that academics like to use. We have to do, it's our currency. But at the same time, we have to give it in a language that the market can understand. So that's why I created my firm, 9 Foundations, licensed technology out of my own lab at Harvard. And we're operating around the 9 foundations of a healthy building, providing services and solutions to corporate real estate, finance, the big players in tech, healthcare setting, schools. So that's kind of how we think about holistic healthy buildings. But I have to say, talk about widening the lens here. We have a chapter in my book called Beyond the Four Walls. I mean, buildings consume 40% of global energy. You can't talk about a healthy building without talking about its impact on our external environment, particularly through our energy system and the cascading effects of climate change. So if you think about healthy buildings, you have to take this really wide lens. It's indoor air quality, sure. It's also the materials, like the chairs you're sitting on, the chemicals that are in them, and our relationship to the natural environment and the effect buildings are having on that. So that's kind of how we view the full package, I think, of a healthy building. One that, yes, it's part disease avoidance, but that's an absence of disease is half the definition of health. Right? It's well-being, it's thriving, it's cognitive function, it's mental health. And so all of those actually influence all of those factors, not just the absence of disease goal.
Mm-hmm. And Joanna, what do you think the most important type of buildings for us to prioritize are right now? Like what is it, schools? Is it corporate offices? Is it public buildings? Is it restaurants? What should we prioritize? How should we think about our priorities?
Sure, so I would say, just to kind of expand on what Joe was just saying, that for a building to be healthy, it first needs to address the needs of its occupants. Because if you are a senior housing facility, you have different needs than if you're a school, and if you're residential compared to an industrial facility. So to be a healthy building, I think there are 3 things you need to be considering. First is, what are the needs of the occupants in the building and the community at large? Because every building has an impact on that community that it's sitting within. The next is, yes, you need to be using these evidence-based solutions and strategies that are identified. So Fitwell has strategies. Joe, they've identified these strategies. These are pretty much the same strategies. The evidence base is the evidence base. We know how to do this piece, right? We know which strategies have an evidence base behind them. And then the last piece of a building really to be healthy is it having a measurable impact on the health and wellness of the people that it's designed to serve? Because otherwise, what's the point? Right? None of this matters if we're not actually having an impact on the outcomes for the people that are within the building, but also that community at large. So I would say that I really wouldn't start to say we need to do one kind of building rather than another. The evidence base exists for all kinds of buildings. There's no reason why we can't do this simultaneously. Like, every building is managed by somebody different. There's no reason why we can't be looking at schools at the same time as industrial facilities, at the same time as multifamily. We know what to do in each of these cases. The evidence base exists, the strategies exist, the knowledge exists, and now the demand exists. So I think it's all of the above. Because how could you possibly choose, right? How could you choose between a school and a senior care facility? And there's no reason to. But the way that you do it needs to be different, because what you need to do for someone over 80 is very different than if it's someone under the age of 18, right? They have different health outcomes, they have different needs, there are different opportunities. Is this an existing building compared to a new construction? Right, we need to be thinking about our entire built environment, because this is something I think public health has come to the fore, obviously, in the last couple of years because of COVID, but I think we all understand now that it isn't about individual health, right? We need to be thinking about everybody's health. I can't put myself in a bubble and be like, I'm gonna be healthy, never mind the rest of you. So this is really like, how do we look at our entire built environment, our whole population, and raise the bar for everybody? Because that's our mission. My organization's mission is really healthy buildings for all. We want market transformation. We're not going to stop until we have market transformation. And we might actually get it now. Now we have demand.
I love that answer, and I think it addresses, to some extent, one of the questions that was asked is how do we make sure that the benefits of this healthy buildings movement and the infrastructure upgrades that we strive to make the benefits reach everybody, and we don't, we experience further stratification of the inequalities during COVID. So how do we actually make sure that everybody benefits from this, and not just the corporations who are cash rich and want to optimize their workforce? How do the schools, the public school system, for example, how do we make sure that we keep students and teachers safe so that we can improve the quality of learning throughout the United States and beyond? Good segue into sort of the next topic I want to get into, policy, regulation. I thought a lot about whose responsibility is this, and started drawing parallels to some of the past movements that we've had. I think the green buildings movement that we've had going on for the last couple of decades, largely spurred and aided or accelerated even by some of the incentives that the government has thrown out there, or even some of the funding. I think we can all agree that the government can play a large role in this, but I wanted to open it up to you guys and ask a two-part question. One, what does your organization that you're up here representing, we have representatives from academia, the private sector, and prestigious medical institutions, but what role does your organization play in this movement? And then also, who else needs to be involved, and in what way? And I'll start with you, Dr. Barbari.
Yeah, I guess one of the things that we can do as an academic center is partner with startup and private sector, and advance the science and popularize the science. I think that's very important. So we could really understand what the standard is. And this is like, 5 years ago, 10 years ago, if you bought a house, you didn't have a radon detection system or a radon mitigation system. Now it's part of the code. And why can it be the same for particles in the air? Or why can it be the same for risk of COVID or airborne pathogens in risk areas or mutual areas like this conference? And I think this is going to be disruption by regulations. There's got to be some regulations that moves this, otherwise it won't move. Mm-hmm. So we develop the science, standardize the science, and then regulate it. And I think that's how people are wanting this. This is important to many of you, and I think this is where change might happen.
Mm-hmm. And then Joe, I know you've worked closely with policymakers in the past and current. What is the role of regulators, policymakers, in all of this movement, and what policy changes do you think we need?
I think it's a really good question. I've spent most of my career focusing on a different pathway, which is the ability to affect change through companies. Because you get this message to a CEO on Friday, it changes on Monday morning. So I've been really disappointed with the regulatory structure and the pace of change. The science has been there for so long. It is so frustrating to see how some of these organizations move slowly. That said, I've been advising the White House, and you probably saw their announcement last week. For the first time, healthy buildings are a pillar in the pandemic plan. They talk about clean air in buildings checklist, clean air in buildings recognition program. They're going to start putting out some of these targets. So the key there is not just that they're doing it and they'll get to it, it's that they've sent the message. And I'm already seeing this permeate across state leaders, city leaders, and companies, because now the White House has used its bully pulpit in a good way to place a marker on healthy buildings. So I'm not so worried about the regulatory will get there, but the marker is out, and businesses respond to that marker. They don't actually need to wait for the regulation. Hopefully it'll get there, we won't have to think about it. But the good companies are already moving fast down that path.
Yeah, and Joanna, what are your thoughts on it? What policy do we need to see, and who else should be involved?
Sure. So, I think I mentioned at the beginning the CDC's our partner on Fitwell, and we were actually named in the White House policy, which was exciting. And I think that that's important, and regulation is important, but I would totally agree with Joe that I think that the pace of change is really being driven by the market. It's being driven by that demand. And that's exciting because it will move faster than regulation. Regulation, will catch up, and it's essential for public buildings, actually. And I do think, our role at the Center for Active Design, we sit between public health researchers and the real estate industry and investors in real estate. And our job is to translate between these two very important sectors and really make it so that folks who are building buildings and designing and investing in buildings really understand, like, how do I take this research, which we don't understand, right? We're not academics, and how do I make it real? How do we make it so that it's practical and implementable at scale across buildings? So we sit kind of in the middle, and we act as this translator, facilitator, and as a way to really kind of give voice to the importance of this in a way that's meaningful to those who are making decisions. Because I totally agree, again, with Joe here, that these conversations before COVID, we were like trying to persuade people to promote health mostly by giving them business case for health. Rarely were people coming to us with health as the end goal. It was really basically, how can I increase my return on investment by promoting health? Now we are very much seeing, obviously, health as the end goal there in and of itself, but we were making that business case constantly for the last 10 years to try to get to the point where there was demand for this, because we could see so clearly that your built environment was impacting health. So I do think regulation is essential, but I don't think it's the only lever that we have because of that overall investment trend that we're seeing globally, which is exciting because it means that we will actually have change that lasts.
Yeah, and with change comes opportunity, and I love that. So I want to talk about enforcement. So play this out for me. Policy, regulation, they get developed. We have indoor air quality standards that are that have evolved and represent the sort of healthy buildings aspects that do promote human health and holistically. Who's responsible for enforcing these, and what should be the consequences of noncompliance? I'll start with you, Joe.
I think this is one of the most important questions out there, and I wrote an article in Fortune with John McComber from Harvard Business School in, must have been May 2020. Who guarantees your workplace is safe for return? The answer is nobody, right? And OSHA, from a government perspective, totally ineffective in this area. I think some of the standard-setting bodies, ineffective, couldn't get their act together. And so it really comes down to well-meaning companies that are recognizing the science, but I'll bring it to the something I said earlier. Where it's coming from is the demand from people, and that's what's providing all of that pressure. There's some top-down pressure, but it's coming from people, and the businesses see this, right? How am I going to stay open? How am I going to stay operational? How am I going to find the next great person for my team if I don't have a healthy building? So that's kind of how I've seen that, that play out just in the pandemic. But it's still the question. I think, talking about a place for opportunity. I mean, this is what this conference is about, right? Who is going to set up these systems, to your point, that says, hey, we're going to integrate all this data. We're going to give a risk score to this building. Everyone, platinum this building, gold rated this, 5-star building. Who's going to come up with that system that says, you walk in here, you don't even have to think about it. This is a healthy building in all aspects, not just COVID. This is a place you want to be. You go to work. You feel better at work. You're thriving. You're functional, productive. And
I know
so
a company
who solves
that
that
can help,
problem? What's that?
I know a company that can help.
Who's that?
R0. Anyway, sorry.
Yeah, no, I know you're down that right path, right? And there's room for these companies, and I haven't seen anybody start to really win this space. And there's good startups coming in that are doing it, but it's a wide open playing field, and one that I think there can be a lot of winners in. There should be a lot of winners in.
Humans win. I think the more competition in this space, the better for humans. And like you said, it's such a massive, human health is universal. And when we talk about like our total addressable market, it's literally every indoor space in the world. Like it's every building. I think it's about time that we have more innovation, more players in this space working to make humans healthier. But Dr. Barbari, I know that the healthcare environment is regulated, and there's a lot of different standards, and there are consequences. Are there any that you can think of that you think might apply to public health or be helpful, or otherwise, share some thoughts on who should be enforcing and how?
Yeah, I agree. It's a gap right now. But who guarantees that our training programs of future generation of physicians is adequate? There are graduate medical education groups that kind of semi-independent that oversees that are ACGME and so forth. Who guarantees that this building is sound and safe? It's not going to collapse on us. So there's not a body right now that's identified for the airspace or for the environment. So that creates an opportunity for startups. You're absolutely right. and the space is wide open. If you define the standards, somebody's going to reinforce them. That would be easy. You can have a clipboard and walk into a room and study it, and have a gadget and study it, like they do when they come and study our hospitals, in OSHA or Medicare or any agency would come unannounced and they study the hospital and they give us feedback for doing well against tons of regulations.
Mm-hmm. And Joanna, your company has the Fitwell certification. You guys do this to some extent. Can you talk a little bit about how you guys think about enforcement or compliance, and what do you tell your customers, your clients, about the consequences of not getting it all right, and what happens?
Sure. So I think it's important to understand that we're in this for the long haul, right? This isn't just a one and done. I have a healthy building, check, right? That is not going to work, folks. So this really needs to be something that's ongoing. You need to be able to continually improve the building. I think it's really important also to make this accessible to everybody, right? So we're not talking about taking this state-of-the-art brand new building and make it 1% better, right? That's actually not really going to affect anybody's health. So really, how do we ensure that we have made a standard, that we've created something, knowledge, that can be implemented across all of those building types to support incremental improvement? I think it's essential. We can't have fabulous environments for 1% of the population, right? That is not going to impact health. So it's really important that we understand what is enough, what is good, what is excellent, because you don't have to do everything in order to promote health. We do need to have a balance. We need to understand kind of where that level is. So I think that that's very important, not to kind of lose that equity issue, because the built environment is something that we are all affected by, and we are not affected by it equally. So even kind of the maintenance of a street, how much trash there is, which affects our mental health, it affects trust, it affects your willingness to walk down a street. This is not equitable, right? We can all probably name parts of our cities or our neighborhoods that have more trash, and they are not the places that have the most expensive real estate. And that is, we can show that with the data. So I think that that's really important. The consequences of not doing it, at the moment, they're market-driven, I would say. So the market is either rewarding you or will start to punish you if you don't have a healthy building. So before COVID, MIT did a study that showed if you had a healthy building certification, your real estate could potentially earn 4.4 to 7% more rent. So increase in rentable income. And it didn't matter which healthy building certification you used, as long as you had a healthy building certification. So there was a potential to make more money. What the market is telling us now is there's a potential for a loss. So this is where health has changed. This is why I say it's a risk. So you've gone from it being a potential positive to a potential negative, or actually a negative. So health has become table stakes. You have to do it. So the market will punish you. It'll either punish you because people won't invest in you, or people won't return to your office, or people won't choose your apartment building, et cetera. So that's going to be motivating in the short term. But I do think we need to be thinking about these things in longer terms. I mean, we've seen precedents. We were talking about this. 100 years ago, New York City had very high levels of infectious disease. 57%, I think, of people in New York were dying of infectious disease 100 years ago. And the response from the city of New York was to look at the built environment and really figure out, like, how can we use our built environment to mitigate infectious disease. They created a park system. They created the reservoir system and piped clean water. What an idea, down to individual homes. They created a new set of standards around housing, which was the Tenement House Act, which said you have to have minimum amounts of light and air for this to be considered a dwelling unit. So there is definitely, and all of that then had a massive impact on infectious disease. I should end the story. So it went from 57% of folks dying from infectious disease to 11% within New York, and that's before the widespread use of antibiotics. So the built environment was used very effectively. Regulation was used effectively. The power of government was used very effectively to really turn around infectious disease rates. We can do that. Again, we need that level of kind of thought and ambition. Other countries are doing it. Other countries are really looking at the fundamental kind of footprint of their cities to leverage it. I think in the long run, you do have a combination, right? You have to have regulation. You have to have enforcement. I don't see that happening in the near term.
Yeah, and I think picking up on a couple points that were put down and kind of amalgamating them a little bit, but I think we've seen behavior change from consumers drive change for corporations. You think about fair trade or sustainable companies. People are putting their money where their mouth is more than ever now, and I truly believe that we will see that shift. We will see people decide to work for employers who put human health and productivity first. I think we will see people decide to rent apartment buildings or apartments or buy houses based on the healthy buildings infrastructure. I think that's going to be a key component to decision making in the public eye. But I want to end with a good question that I think you all might have very different and unique perspective on. It's the top one here was, do you have a state-of-the-art example of a facility due to the needs that we have? So basically, good example of a healthy buildings. And I thought, from a healthcare perspective, Joe, from your sort of consulting practice and all your work, and then Joanna, I'm sure you have good data on sort of your clients and their sort of compliance as well. But I figured you guys might have interesting perspective. But Dr. Barbari, I'll start with you. Do you have an example of the healthiest building or room or environment?
I like to think it's my hospital.
Yeah.
We've worked hard over the last years to do so, but our hospital was designed not COVID in mind. It was designed 20 years ago, 30 years ago, 40 years ago. We've made a lot of progress, but we can make a lot more progress by studying new technology and working with startups so we can really advance the science and develop that technology. That's my answer.
Joe?
So we do, but can't share it. But I'll tell you some things that are coming very soon. You'll start to see. This can be done in practice at scale, and by this I mean a building that is optimized across all of these 9 foundations of a healthy building. And I don't just mean we're meeting the occupational limits or doing what everybody's doing or kind of hitting these just better than bare minimums. I'm talking about truly health optimized buildings that also conserve energy and are not contributing to the climate crisis. So there are about to be a whole bunch of examples coming soon, but I want to take that other question there too and add to it that, the tagline for my Harvard Healthy Buildings program is health of all people in all buildings everywhere every day. And it's this equity piece that this will be an absolute failure of a movement if it is not for everybody. If these best practices stay in the best buildings and the best cities only, who have the resources to do it. And I want to say it doesn't have to live there. It's not expensive to create a healthy building. I would take schools we've worked with during the pandemic, just giving buildings a little bit of love. We can give your building a tune-up like you do for your car. We don't tune up our buildings. Just do that. Bring it back up is enough to create kind of these healthy buildings. It doesn't have to be an all or nothing, but start moving in that direction. So it's not exclusive either to commercial real estate, biotech, pharma. It's schools, it's homes, it's affordable housing. It can all be done. There are examples out there, and there are a lot more coming, in months. Yeah.
I can't wait. Joanna, your turn.
Sure. So every year we give out an award, the Best in Building Health Award. So I can actually give you who are statistically the best buildings. So I'm going to give you 2 really kind of diverse examples because this is kind of emblematic of the movement. So the highest Fitwel score of all time was just achieved this year by Peloton, who I'm sure all of you know who they are, and it probably isn't surprising to you that Peloton have the highest Fitwel score. But another project that is also getting a Best in Building Health award is called Spring Creek. And Spring Creek is the largest affordable housing development in the country. It's in Queens. It was built in probably the 1950s. It's a Mitchell Lama project. And they got a very high score for the community, the whole community. So they used a certification, Fitwel certification, which is the certification that looks at all of the spaces between the buildings, as well as the kind of shared buildings. So here we have 2 really extreme examples. Spring Creek has 17,000 residents. And so just think of those 2 examples, and this is kind of what we've all been saying. This is applicable to all buildings of all ages for all uses. Every building can be optimized towards the health of the people that they're serving. This isn't a kind of I have to do everything or I'm going to do nothing. Everybody can make incremental changes.
I love the idea of lifting up and sort of championing the best in breed, like the people who are doing the best. And I also love that you had an example that it's more emblematic of the for all mentality as well. Affordable housing. Everybody should have access to healthy buildings. So we are out of time. I think we're over time and competing with happy hour at this point. So before we go, just thank you everybody for attending, and let's give it up for our panelists. All right, well, thank you everybody, and look forward to Joe's healthy buildings that he's going to reveal here in the future, and we'll see you guys next time. Thank you.